Okay, well, it is 10:35, so I think to be respectful of your time, we'll go ahead and get started this morning. First, I want to thank everyone for attending with us today. We're really excited about having Chief Blasingame talk to us a bit today. I want to thank the Area Agency on Aging, Dignity Memorial, and the City of Plano, Sam Johnson Rec Center for partnering with the Wellness Center for Older Adults to provide this series for everyone. We're very excited about all the topics we've got coming up and think that you'll find them very beneficial. So we have everyone muted, just a little housekeeping. We have everyone muted. So if you have any questions, please type them in the chat box. If you're familiar with Zoom or you're not, at the bottom of your screen, if you hover your mouse over, the bar will pop up and just click on chat. Type your message in there and I will do my very best to address all of those questions, tell them to Chief Blasingame so that we give him the opportunity to give us an answer. So without further ado, I think we will let Chief Blasingame, he has a wonderful introduction of his own qualifications and experience, and I would probably butcher it. So I will let him share that with you. He is the fire chief for the Prosper Fire Department, and I had the privilege of hearing the chief's presentation about a month ago to one of the Rotary meetings, and I think you will all be very pleased to hear the chief's wisdom and kind of help us as we navigate the crazy times right now. So Chief, welcome and thank you so much for being here today.
Thank you very much. Can I ask you a question? Is the most of the people that are on, are they from one particular area? Are they from Collin County? Are they from like Plano? Or are they from spread out?
Marty, do you know?
No, I don't. To be honest with you, I think we have the majority of them are going to be from Collin County, but I think there is people on here from other counties as well.
Okay. All right. Wonderful. Well, that helps me out a little bit. My name is Stuart Blasingame. I'm the fire chief for Prosper Fire Rescue. I've been here in Prosper for since 2002 and was in Frisco previously with the fire department before that since about 1997. I am a certified public manager through Texas State University and a fire service CEO through Texas A&M, and I have a degree in fire administration. That being said, let me tell you, when it comes to COVID-19, I am not an expert. I follow it like many other fire chiefs do. And what I have learned is just been from our daily, we pretty much wake up with it and go to bed looking at numbers and listening to the counties and listening to the states and what the state says, the county, the health departments, and we go on and on with it. Some of the information resources that we look at, we have access, a lot of the fire departments and emergency management officials, to what's called EM resources. And what that really tells us is it really breaks down the hospitals, tells us how many hospital beds there are. It tells us how many ventilators are there, how many's in use, what the percentage of rooms that are available. It really breaks it down into a usable level where we know. As we said, the Texas Department of State Health Services is the primary that is overseeing COVID-19 for the state of Texas. We under them and in conjunction with them is the Texas Department of Emergency Management, who's working very close with Governor Abbott. Local Prosper, I can really only tell you what we're doing here in Prosper, and we border two counties. We have two counties, Collin and Denton both, and in Collin and Denton counties, we're about split down the middle. So we work with the Collin County Health Department and the Denton County Public Health. We get a lot of information from, just like everybody else does. Johns Hopkins University has a coronavirus research center. There's even a new one that we're finding out about that's here in Dallas, I believe, from the University of Texas in Dallas. The North Central Texas Council of Governments is big here with us, giving us information and working with the municipalities. And then we have a local disaster district committee that's out of Garland that we also work with on very much a daily basis and find out. So if we could, the next slide tells you some of the target hazards that are really being focused on. Your nursing homes and long-term care living centers, your packaging plants, your jails and prisons are a big topic right now because they are running rampant in the prison system, especially. Hospitals, we worry about it, but the hospitals are really good with sanitizing and making sure that you're safe when you go in. So why it's a concern, we're not seeing a lot of spread or very hardly really any spread very much in the hospital system. Healthcare workers in general, though, they're around it. If they get it, then they're patient to patient, and not only that, they take it home with them for those that are. And every precaution is taken to provide for the safety, but it can happen anywhere. And, you know, any facility that has large gathering capabilities, your stadiums, your churches, all your concert venues, large office buildings, et cetera. But as I noted on this slide, a lot of the recent spikes in the cases are from jails and prisons and nursing homes that we've seen. I think Plano had an additional 30 just here in the last several days that from one nursing home. So we have seen a spike to some degree to what we were used to seeing. So I can tell you from a fire department staff side, many of us in the fire side, and we're on the fire service is a pretty tight knit group, and so we are all taking precautions with our staff. Here in the town of Prosper, we formed what we called a COVID-19 task force, which was essentially made up of our executive staff and code enforcement, and we actually have morning briefings and go over our numbers, and it's also where we talk about our reopenings. It's where we try to figure out how we allow people to come into City Hall or Town Hall and to be able to do it safely, how we allow people to go into any of our municipal buildings, and how we can do that and still maintain the highest level of safety that we can give to our residents and visitors. We did a partial activation of our Emergency Operations Center that included our fire department, police department, and emergency management coordinator. And that was really just more to monitor how things were going. At this point in time, a lot of our staff, and this goes across the board for a lot of municipalities, have started doing a lot of telework. So we're working, a lot of us are working from home if you're in administration, or if anybody in the office setting that can't be spread out. We started allowing those people to work from home the most they could, and that presented some challenges, but it's also, to be honest with you, it's worked out really well. We still are getting a very similar, if not more, work that's being completed, and we're keeping that distance between our personnel. We reduced our close personal contact, like in our municipal buildings, and unless you're in a fire and police. And the reason I say this is, and everybody has their own idea of what this is, but we consider ourselves a family. These guys are there 24 hours, and it's almost impossible for them to get away from each other. We don't require our personnel to wear masks inside the fire station, but we don't allow other people from outside on very, very limited basis to come into our station for that reason. When we are out in public, however, all of our people are, unless they're on a fire or a really bad scene that is just impossible for them to wear a mask, they're wearing masks just like a lot of other people are. Especially on our medical calls, everything's being worn. So we have masks, eye protection, our gloves, and then if it's any kind of respiratory situation or anything like that, they're wearing even a gown on top of that. So we've added a lot of decontamination procedures. We're blessed. We have a decon, what we call an aeroclave system, that's virtually a fog machine that will kill just about any virus, including COVID-19. So any respiratory call that we run on, it gets done on a routine basis anyway, but we also follow that up, and we fog out every ambulance we have after any respiratory call whatsoever, or any suspected fever or anything like that. So we're trying to make sure that we are providing the highest level of safety to our people. So originally we closed our library, our senior rec center, our parks were closed. You're starting to see those be reopened with limited, at a much limited status. Our library is only bringing in about 25% of the people. They have to maintain social distancing. They have to wear masks. Our books are actually being sanitized before they're being given out, and upon return before they're put back into service. So we're starting to see a few things. Our parks are opened up. They're just doing the best they can to continue to decon as many things as we see. So we give a daily update out to our residents via social media. And up till a couple of weeks ago, to be honest with you, and they're still different in how they do it from county to county. So Collin County made the decision up till a couple of weeks ago. The counties were overseeing all, the new cases. We were being notified by the county, who just a choice few of us here in town. We would get notified that, hey, this person and this residence has tested positive for COVID-19. What that allowed us to do was go into what we call our computer-aided dispatch, and we would make a alert in there. So the routine, the people on the streets had no idea who in town had COVID-19 unless they got dispatched to that address. If they got dispatched to that address, an alert would pop up and say someone in this residence has tested positive for COVID-19, which gave them kind of a jump start on how to handle a patient. We started sending only one of our paramedics. We normally respond with 5 to 6 paramedics on every medical or injury. And we still do that, but we have got to the point where we changed how we were doing things. We started sending one person in at a time to make contact with a patient. If it was respiratory, they're given a mask. And so we can try to protect ourselves and the rest of the workers. If it's something really severe, CPR, stroke, something that needs additional hands, they're going to get every hand we got. But we were doing that as an abundance of caution to try to keep our people safe and try to keep the people safe inside the residence. So that was a little bit different on what we were doing as staff, trying to take care of everybody. But the counties were doing everything separately. And then about a few weeks ago, the state asked to take it over. It wasn't really mandatory. They allowed each county to do it, but to be honest, it would have been easier if it was mandatory or either way, because now like Denton County is still taking care of their side, and Collin County has turned most of their stuff over to the Texas Department of State Health Services. So some of the things that we found were that a lot of the things are, you can go to the next slide. A lot of the things are not, I don't want to say delayed, but they're not in real time as we wish we had. And we're no longer in the Collin County side, especially getting the reports like we were like I explained a minute ago, that this household has it. But to be honest with you, we've treated for about the last 2 months or better at this point, since it started in March. We started having to where we treat just about every call as a suspected COVID case. And then we ask questions and make contact with that resident by phone ourselves to ask a series of questions before we even enter the resident. So it changed a lot. So in the state of Texas, you've got about 237 out of the 254 counties that are reporting cases. Now, these are from a couple of days ago. And here's one thing I want to caution you with the stats that I've got and that I'm going to go over. They change drastically up and down almost on a daily basis. And then it depends upon who the state website doesn't necessarily match the county website. So it's been really difficult for us to really grasp our hands around it. And I want to say it's been seamless, and they're taking such great strides to take care of everybody and to do what's right. But a lot of the numbers that we've seen have really fluctuated. So what we see when we used to see 20 or 25 a day that would get it, and then around the same number that would come off. Now we may see lower, and then all of a sudden there's what they're calling a data dump. So one day, all of a sudden, you'll probably, if you've watched the news, which I'm going to be honest with you, I've got to the point where I can't hardly watch the news anymore over all of this, over several things going on in this world. So I pay more attention to just these cases for COVID. But I can tell you that we have just seen some discrepancies and some things that we question. So you'll see that they say, Dallas hit a record number of cases today. And they may have. But in a lot of cases, what we're finding out is the cases may have been held for 3 or 4 days, or it may be a series of nursing homes or jails or something like that people got tested over time. And then when it all came down to it, they dumped everything in at one time. So it's, to be honest, it'll scare the death out of you. You're sitting there going, oh my God, they just had a record deal. But then you find out why, and you're like, okay, they didn't spread it out over the 2 weeks that they tested. They dumped all of them in at one time. So we've had a lot of things like that as well. So in Collin County, as you can see up at the top, the total tests that they've done is 1,522,434, and that's in the state of Texas. They've had 93,206 cases reported and fatalities of 2,029. The recoveries are over 60,000. But again, if you look at some of the numbers, they just, when what we're used to seeing, they just don't. We don't. I guess I don't. I take some of it for a grain of salt. We have to watch it and look at trends. They're saying in Texas the estimated active cases are 30,496. Now this was as of day before yesterday. Keep in mind, there's still 17 counties in the state of Texas that haven't reported any. And there's some that have very few, but then there's some hotbeds. Your bigger cities, your Houstons, your San Antonios, your Austins, your Dallas, Fort Worth, some of those larger counties, including Collin and Denton. You know, we've got more than a lot of other counties like Fannin and things like that, just from a density level where it's spread out. And in Collin County, the fatalities you can see are 38. Kind of the same similar numbers that you see for Denton County, except the current cases are way up. Now the current cases, to be honest with you, just jumped, almost doubled in the last week or so, and a lot of those are from data dumps. And another problem that we have had with, and I'm just going to be honest here, and they admit it, Denton County is concentrating on, unlike a lot of people, we want to know how many currently we have. Denton County has focused on who's got it and treating them. So if they have somebody that many of these patients are, in our opinion, have been in the system for several months, which means they shouldn't be in there anymore. However, Denton County only has so many resources. So Denton County will then go across and say, John Smith, they'll try to contact him and say, you had COVID-19 in April 1st. And typically there was about a 14-day span there. Some do 21, some do 14, and it should have been over. Well, if they can't get a hold of John Smith to confirm that John Smith is well and doing great, they leave John Smith in the system. Well, to me, that skews the numbers. It doesn't tell me truly how many current cases we have. So I don't believe, to be honest with you, and I will tell you some of what I'm going to tell you. And what I'm talking about now is my opinion. It's strictly that. It's my opinion. You can, I'm not an expert on it, but I am on all the county health department calls, and we've asked many times why we have patients in there that have been in there for a couple of months, and that's their reply. Hey, we just can't, we can follow up as much as we can, but if they don't get back to us, they're not comfortable taking them out of the system, and we just think that it just continues to make a bad problem look worse. Fatalities in Denton County have been just a little bit less. It's been 36. And I'm going to get to some slides here coming up. You can go to the next slide. And one thing I want to tell you, like even in the town of Prosper, and this goes throughout, when some of the numbers look bad, you have to understand that and this again is my opinion, but you have to understand that some of what we see when it comes to the deaths and things like that, a lot of them are pre-existing medical conditions. We have a lot of cancer patients that their immune system is down to begin with. They catch it, and a lot of them are elderly, and they have severe underlying medical conditions. And so a lot of them, I hate to put it this way, but it's just the truth, would not have survived regardless. But if they had contracted COVID-19, it went down as a COVID-19 death. So it's definitely something that I don't want to say that it's not exactly as it appears, but some of it, in our opinion, you would have seen this anyway. I realize I saw one person post that the slide is hard to read on y'all's side just because of how it is. We can try to expand it, but I will tell you from the left side is less than 1 year old. So under 1 year, and then it goes all the way up. It's typically in 10-year increments. It's like less than 1 year, then it goes to 1 to 9, 10 to 19. So you can see under the age of 20, we don't have a lot of cases in the state of Texas. Matter of fact, under 1 year, there's only one case in the state of Texas that we know of. 1 to 9 years old, there's only been 180, and that's statewide. And it continues to go up from there. 10 to 19, 471 cases. But I'll show you a slide here in a second. When it gets over to, you see the 4 peaks in the middle there. That last one is 50 to 59. That's the last virtually 10-year mark. And then it goes in 5-year increments from 60 to 64, 65 to 69, 70, 74, 75, 79. In the far right column is 80 plus years. So you can see that from about 30 to 50, it looks like it's about average. Well, really, if you double stack the 60 and 64 and the 65 to 49, it's pretty close to the others. That tells you who's contracting it. One thing that, of course, the recommendation is if you don't have to get out and you're elderly or you're seeing your good years, then if you don't have to get out, then don't get out. If you do, get out with a mask. And so what we're seeing is a lot of people in the 60 to 80 range are not getting out as much as they were. And so they're not contracting it as much as anybody from probably 20 to 60. And so you can, that's kind of where we're at there. If you can, it's a little bit more in males. It's 53.5% in males versus females. And then as far as the Hispanic population is 40.1% of the confirmed cases. And then Black is 16.3%, Asian 3.3%, white is 27.2%, and the rest is kind of unknown. So it kind of varies from race. Could you go to the next slide? And at the end of this, we'll be glad to come back and give you any additional data over any of these questions and to dive into it further if you really want to hear it. This is however, you just saw my slide before that talked about the what they were seeing on who was getting it. Now, this is the slide, unfortunately, of the completed fatality investigations. So out of all the deaths that they've had, that they've investigated, this is what you're seeing. So under 1 year, nobody's died from it. 1 to 9 years, nobody's died from it. 10 to 19, 2 people. 20 to 29, 11. 30 to 39, 13. 40 to 49 is 26. Then 50 to 59 gets up to 72. And a lot of that, I believe, is because there's a lot more people 50 to 59 getting out than there is from 60 and up. Once you get to about 60, it's down to 60 to 64 years of age. 65 to 69, you have 74. 70 to 74, you have 69, and then 75 to 79 years, you have 70. 80 plus years of age, 265. And if you went back to the previous slide, you'll see that the people that had it, that were above the age of 80, wasn't that many. And so they're finding that the mortality rate is much higher on these investigations when you're over the age of 80 years old. And a lot, I have to tell you that when the deaths come across and we see them, there is a considerable amount of people that have underlying medical conditions. And yeah, I just saw the question on there about 85 and up. So unfortunately, the way the Texas Department of State Health Services is crunching their numbers, they get to 80 and it just goes from 80 plus years. It's not broken down like it was in 5-year increments. But it's once it gets up there, you can definitely see they're more susceptible to fatalities when they contract COVID-19 on this slide. Can you go to the next slide? So a lot of things which you'll see in our region when it talks about the Dallas-Fort Worth region and you see it on TV, a lot of times they call it Region E. And this is made up of 19 counties. And so as you can see all those colors on the map, and I realize it's hard to read. There's no way for me to put that on there. I tried to add that to the left just to show you our region. But where Collin County is at on the up at the top right in the purple, that's the 19 counties that make up what we consider our region. So a lot of times when you see things, the state and the local areas they'll call it Region E, which is a lot of people call it the Dallas-Fort Worth area, but it's actually made up of all of those counties that you see to your left, all the way up to Grayson County, and so and Hood and Hunt, and so it's a very wide area that you see there. If you can go to the next slide. So this is just to show you as of June 17th. And this, some of this is Collin County, some of it is specifically to the town of Prosper, but it just gives you an idea. So the entire county source on the Collin County's website said 335 active cases, recovered 1,295. The Denton County was a lot more, and that's what I was talking about. They had a huge data dump, and they went up to 815. But they're showing that active cases. And again, I want to reiterate, in our opinion, and that is strictly our opinion, but from what we've heard and seen, I do not believe there's 815 active cases in Denton County. There are a lot of people, for whatever reason, that have not confirmed with the county that they have been over this for a month or two, and they're still in the system. So I don't like how that's being done, but these are all we have to go by. In Denton County, for the town of Prosper, we have a total of, at this point, we have a total of 3. We had 8 cases total, 3 active, and 5 that have recovered. We had 1 death, an elderly patient that had a lot of pre-existing medical conditions. Collin County, again, right now we have 13 they're showing as active. Some of those are also in the same household. And so we've got some households that have 3 or more in the same house. So we're currently showing 13. If you go to the next slide. So what we look at, one of the things from an emergency management standpoint that we look at and that mean probably the most to me is the trends. So I like to see how it compares over the last couple of weeks, 2 to 3 weeks, and then we actually look even further than that. This is something we look at every morning, though. We send this out every morning and try to see. This is for our entire region. And so you will see a pretty good increase over from the June 10th to June 17th, which was yesterday. Now, a lot of that, again, what we found, a lot of that came from a prison. And some of them came from a prison, and a lot of them came from one nursing home. So when you added the 2 together, probably the rest of the area was no more, no less, but these just few locations went way up. And so it made the numbers go up considerably. So this is the hospitalized patients, COVID-19 hospitalized patients in our entire region. So out of all 19 counties, we only have 765, and that sounds like a lot. And I don't want to belittle it. It is a lot. But spread over 19 counties, it's not as bad as you think. If you can go to the next one. So this is lab-confirmed COVID-19 patients in the hospital's EM resources, and it's broken down by Collin, Denton, Dallas, and Tarrant. And so, as you can imagine, Dallas right now has the highest level of patients in. On the 17th, they had 391 patients in Dallas. The Tarrant County system and all of Tarrant County, they were down to 256, or actually up to 256. And then it got down to 109 for Collin County. And then Denton County was down to 14. And so these are, again, you have to understand a lot of the patients that contract COVID-19 from many counties get brought to our hospitals in Dallas because the smaller hospitals in some of the rural areas simply don't have the resources to handle patients and be able to contain the spread and those type of things. So a lot of these patients are moved to Dallas hospitals, Dallas, Fort Worth, some of your major areas throughout the state in general. Most of ours in Collin and Denton go to local. There are local hospital network can handle them, but most of our local hospitals in Collin and Denton are a lot larger than your smaller rural hospitals. If you can go to the next slide. This is the ventilator stats. Now, of all things, this is one of them that means the most to me when I'm looking at things. So, but what you need to understand is the top line that you have there is Collin County is how many vents available. So right now in Collin County, you have 131 vents available to you. So it's hard. I know the slide's hard to read. I apologize for that. On mine, it's much clearer. The actual Collin County vents in use right now is 98. However, the Collin County COVID-19 on vents. So when I'm worried about COVID, I'm looking at that bottom line. I'm looking at the gray line on the very right-hand side of each column. It's up a couple, but not much. So we've been averaging probably around 20. We had 22 on June 6th. We're at 22 as of yesterday. So it dropped down a little bit. It went up. So that's in all of Collin County on people that are actually on ventilators that have that. You got 22. But the good thing is people are like, are we going to have enough vents if this outbreak continues? Well, you've got the lion's share, 131, that are not being utilized at all. And so that's a good thing. If you can go to the next slide. The next slide is our Denton County vents. So kind of the same thing. We've got 88 vents available. And as you can see throughout the top, it's been pretty consistent, anywhere from as low as probably, it looks like around 80 or actually 76 up to about 95 back on June 3rd. So we've got, it just ranges. But right now in all of Denton County on vents, there are only 5 people in all the Denton County healthcare system on ventilators from COVID-19. Now, the other things, when you see some of the others and you see some, like if you're watching the news and you see the hospital capacities, the reason I don't pay attention to that is because you should see that go up. And what you don't know, and I didn't know this either until last month when I sat down with my medical director and we had a discussion about it. So you talk about essential workers, the first thing that comes to mind during this pandemic is the hospital system. What you didn't know, and what I didn't know either, was that people in our local Dallas-Fort Worth area were being laid off, furloughed, left and right. And what happened there was when the state decided, hey, we are not going to allow any elective surgeries. Well, what I didn't know, according to our medical director, was some of those elective surgeries are transplants, liver transplants, heart transplants, things like that. All the surgeries that are done, knee surgeries, elbows, arms, shoulders, all of those things where people would normally go to the hospital for, they weren't going. So in virtually all departments, the hospitals went down to less than 40%, where some of these were used to occupying, 80% or better. They went down to 40. Well, when they had all this staff and they were prepared to take care of everybody, they didn't have the patience. And so they started having to furlough. One of the largest doctors networks in the state filed for bankruptcy about a month and a half ago. Now it doesn't look like they're going to completely dismember, but they had to redo their whole organization. And so those were things that, to me, I was shocked. I was like, okay, what do we need the most? Healthcare right now. And yet half the healthcare workers are being laid off, and you weren't seeing that on the news. You weren't hearing about that. And so I was glad when they started allowing some of these things back, because it hurts the entire, not only economy, but all these people from hospitals. I never thought if you were a hospital worker during a pandemic that you would be furloughed. Well, you absolutely were, because the hospitals couldn't afford to pay them. You can go to the next slide. So here's something that we found that is very scary to me. And this was that a study was done by MedStar, and in North Texas residents are calling 911 a lot less. And that compared to April 2019, the number of patients who were in cardiac arrest has increased, was up 113% as of April. And the ones that were pronounced dead on scene by MedStar crews rose 164% over last year. So what happened, and what happened here was that we don't believe at any point that, and what the study showed, that people weren't calling, and they would have chest pain, they would have stroke-like symptoms, and for a couple of different reasons, they would not call 911. One was they were scared to get COVID-19 if they went in the hospital. The second thing was some of them, especially that were elderly or up there in years, did not want to leave their spouse. And they were like, listen, if I go into the hospital, they are not going to let my husband or wife or my family come in. And they were scared of dying alone. And so they would have chest pain and not call or serious conditions and not call 911 to not go to the hospital. Well, unfortunately, what we saw was if you don't call 911 when you're having chest pain and your heart is dying, and we cannot get to you very quickly and do something about it and get you to a higher level of service, being a hospital, and get you to the cath lab or whatever it is, we can't help you. And that part of your heart dies. So you only have a certain amount of time from the time your heart is, when you're having what's considered an MI or a heart attack, for us to give you any kind of care that can reverse that damage or save your life. People quit calling. So they were dying on scene. They were even, people would find them dead in the morning, or they would find them, I witnessed this myself. I questioned this, to be honest with you. I was like, is that really right? But then when we went back and looked at our numbers, they're consistent. We didn't have as many cardiac patients as what we were used to seeing, or stroke patients. So what really, really scared me with that was when I saw that, I had a resident, and of course I can't say their name, very well known, very educated, a very affluent resident. And come to find out, they called me on a Sunday, not 911. They called me and asked me what the normal heart rate should be. I told them, and I said, why? And they said, well, since last night, this was 11 o'clock on a Sunday, about 8 o'clock the night before, this patient's heart rate went up over 150 beats a minute. Most of you, if people that are runners or exercise and work out, they don't get to 150 beats a minute when they work out in a lot of cases. So this person thought their body thought they were running a marathon for about 15 hours. So they finally called. I went out there and could not believe they not called 911. Checked their blood pressure, which was sky high, and checked on this patient and immediately felt the pulse. And I was like, oh my gosh. And I said, I've got to call 911. You've got to get to the hospital. This patient had a thyroid issue. This thyroid issue could have very easily killed this patient. Very lucky that this person did not have a heart attack, and she was at the hospital for about 2.5 hours. They did blood work, said you got problems with your thyroid, gave her some medication. She was allowed to go home with a normal heart rate less than 3 hours later. So I got to see it firsthand, and y'all, I'm just going to be honest, it scared me to death. It scared me to death because I thought people are that scared. And I don't blame you. I don't blame anyone for being scared of it. But I can tell you that the precautions that are being made are to protect you in every sense of the word. And so I can't tell you enough. If you or someone you know is struggling with that, please call 911 and let them take care of you. And I know some of the other things that they're starting to allow, a visitor here and there and things like that. But being away from your loved one for a few days or a few hours versus not seeing them anymore for the rest of your life is a big deal. So you can go to the next slide. So again, this just showed that the trends across the country were the same. So they surveyed 860 EMS agencies, and 69% of the respondents said the EMS response had decreased at an average of 34%. And then, as I told you earlier, hospitals too are reporting a reduction of cardiac patients and stroke victims. And when I talked to them again, even the hospital said, listen, you don't just all of a sudden, they're used to seeing a certain, I'll give you an example. My medical director for the town of Prosper works at Baylor McKinney. No, I apologize. He works at Medical City McKinney. And he told me firsthand, he said, in our ER, we're used to seeing about 250 patients a day that walk into the ER. And he said when last month, when this was really at its prime, in our opinion, where things were shut down, he was seeing less than 50 patients a day go through that same ER. He said these medical conditions haven't gone away. These heart attacks haven't gone away. It's just people now that are, not coming in and not calling. And unfortunately, that's why we see a lot of the fatalities go up that we've seen. You can go to the next slide. So this was the daily cardiac response volume and disposition from 2017 to 2020. So as you can see, last year, all the way through last year, pretty consistent on cardiac arrest cases that we saw. And then all of a sudden you see it just completely jump up for 2020. And that is just very scary to me, just to be honest with you. So we will just have to see where that goes and hope that number comes down. And the next slide. That's pretty much the presentation. I can't open chat. It looks like there's some chats, and I'll be glad to answer any questions that anyone has. And again, I just want to reiterate to all of you that I was very proud to come on here. I was asked by a really good friend who's part of Plano's Rotary that was part-time on our staff. She was our LaShawn Ross. She was our human resources director for interim, and she knew that what we were doing on a daily basis, so she asked me to do it for Plano, which I was a little hesitant because one of my good friends is Plano's fire chief, and I can tell you they have an outstanding organization that are on top of this daily. And then when I did that, I was again asked to present to you guys. So I hope it was beneficial to you. And again, I do not claim to be an expert in any capacity on it. only what we're monitoring and seeing.
Chief, we do have a question regarding whether or not your firefighters have been tested.
So we have not tested all of our firefighters unless they were symptomatic for something. We test on a different level. We check temperatures every morning before they can come through the doors. We have a crew that stands there and they check their temperature, and then we actually check it a second time at 7 p.m. So we do it at 7 a.m. and 7 p.m. We check temperatures. Anyone that is symptomatic whatsoever or that we felt like may have been exposed, we sent for a test. To date, everybody has come back negative. We've only had to test 2 or 3. They've all come back negative on our scene, on us. I reiterated not only to our staff, but strongly recommended it to our entire town staff, that anyone that suspects that they're not feeling well does not come into the office. I told them, we will work out, even if you don't have sick time, we will work it out, but do not come into the fire station, to the police department, or any municipal building if you don't feel good. If you think you've got flu-like symptoms, I even told people, if you've got a little bit of a cough and you're not 100% sure that that cough is related to, I've had some people say, I think it's allergies. Like, well, what do you mean you think it's allergies? If you have allergies every day and it's the same thing, I'm okay with it. If you normally don't have allergies and all of a sudden you've got a little cough, do not come into the building. And so we've taken a lot of precautions there and checking our people. And then we have some avenues for us that we can send our people to the hospital, and normally we get the results back a little bit faster. But anybody suspected that has it or that's been around someone that has it is off work until we confirm they don't.
Joy, I think we can you hear me?
Yes.
This is Marty. I want to remind everyone that in their instructions to log in today, there's a link to all of the chief slides in a PDF. It's out there on a link that you can download them, and then you'll be able to see all that information. I apologize. When I go to full screen here, for some reason I lose my capacity to control some of the other things that are going on with the webinar, and I haven't figured out how to overcome that, so I apologize. But you should have a download link for the slides in the email with instructions that you received for today's webinar.
Thank you, Marty.
And one thing I would say to all of you, and I have to be honest, and I'm hesitant to tell you this, but I'm very transparent and upfront. Even when I compared the other day when the governor had his calls, and don't get me wrong, I think they do a fantastic job, but I had some slides, and I'm one to really dive into them. So when I looked at even some of the state slides, to be honest with you, some of them contradicted themselves. Like, for instance, for our region, on the governor's deal the other day, it actually showed the total reported beds for the Dallas-Fort Worth region were 14,383. But then when I went to another slide where he showed statewide total beds, instead of 14,383, it showed 14,993. And I'm like, okay, that's not right, because we're talking just one region, and our region doesn't include your Houston's, which is a medical mecca, and San Antonio, and any of the other counties other than our 19. And I'm like, so some of these, and to be honest with you, I looked at that and I went, how is that? Because I would think of all things that the state, when they put a slide up, is going to be 100% accurate. But I question some of the accuracy on there and wonder if some of it is just, there's so much data and there's so many different data sources that are coming out, and there's only so many resources. And so I caution you, this is the data we look at. I pay closer attention to my area than I do. I mean, I'll be honest with you, and I hate to say this, from my standpoint, I don't care what Houston does. I want to know what Denton County and Collin County are doing. And the primary two things I look at when I look at these is how many COVID-19 patients are in the hospital and how many COVID-19 patients are on ventilators. I don't worry about how many ventilators are available because there's more than enough. I don't worry about how many vents are in use because those vents in use are for everybody that's had any surgery. You have a heart surgery, you're going to be on a vent when you come out. If you have any transplant surgery, you're going to be on a vent. Most of them are going to be on vents for a short time, no matter what surgery they've had. So I don't worry about that. I look at how many COVID-19 patients are on vents and how many COVID-19 patients are in the hospital. Other than that, those are normal patients that are having medical problems and that are in the hospitals. So those are, I just wanted to be clear that some of this data, I'm not saying I question the lower slides, which are like slides 12 through 18 or 12 through 15 as much as I do some of the overall numbers. But to be honest, those are the best. That's the best we got.
That's wonderful, Chief. We thank you so very much. It looks like everybody is very pleased with the presentation and thankful for all the information that you've been able to provide for us. We thank you so much for your time today.
It's my pleasure, and I feel very privileged that you asked me to do it, and I hope it was what you guys were looking for. Again, I'm not an expert. I just simply we feel like it, to be honest with you, but we definitely I definitely don't claim to be. I just try to give the information out to help educate our residents and the people in our area, just so they kind of know what to look for. And the best thing I can tell you at this point, and I know they've gone back and forth on it, is that if you are susceptible, if you have any kind of immunodeficiency, if you have really any serious medical conditions and your immune system's low, if you're elderly and you got to get out or you want to get out, wear a mask. And so I have a little bit of an issue, and this is personally, and I'll just tell you, a lot of people wear masks and gloves. You don't have to wear a mask in your own vehicle. I wouldn't recommend that. But when you get out around people you don't know and you're going to be within 6 foot range of them, or even maybe a little bit more, wear a mask at that point. You can wear a washable mask that you can take back home and wash when you feel it's contaminated and that kind of stuff. Gloves, the problem that I have with gloves is I think hand sanitizer does just as good, if not better. And my problem with gloves is that most people don't use them appropriately. And so I know a lot of people think they're doing the right thing, but if you get out of your car with gloves on and then you go in and you shop and then you come back and you get in your car, and I've seen people driving down the road with their gloves on after leaving stores, you've just contaminated everything in the world that you were trying to prevent. And so we carry, I can tell you myself personally, I have masks in every vehicle we have, and I have sanitizer in every vehicle that we have in my house. I wash my hands even if I don't think it needs to be washed. I wash them more than I've ever had before, and I had pretty good, cleanliness before. But I wash them a little bit more because that's how a lot of germs spread. I saw something pop up a second ago, question about the CDC on their website, cdc.gov, will have anything that you really want to know, but there's really nothing outside of normal cleaning that you have underneath your sink that you need to do. So your Clorox wipes, your 409s, your things like that you can get, spray handles down, spray faucets down, spray your counters down, and your doorknobs and things like that, and maybe pay a little more attention to those items. The things that you touch all the time, your cell phone, your phone's inside your things you pick up with your fingers. You keep those wiped down the best you can, hopefully with some type of sanitization wipe, like a Clorox wipe or something similar. And you're doing about all you can do inside of a residence. We still have to live. You still have to, the thing I tell people is I have to live my life. I'm not one that I will not sit at home. to each his own. If I had an immunodeficiency or serious medical condition, I'd probably have a different outlook on that. Other than the fact that I eat too much chocolate and drink too much Dr. Pepper, I'm pretty healthy. And so I won't stay home. Well, if I feel like I want to go out, I go out. But I'm cautious when I go out. And I try to make sure that I've got hand sanitizer and those things. So those are the things I would encourage you the most. And if you are immunodeficient, if you do have serious underlying medical conditions, unless you have to get out, I just wouldn't recommend it unless it's something you feel you have to do. And then if you do it, just be careful, you know.
Yeah.
Great words of wisdom, Chief. We appreciate that.
Yeah.
You bet.
Especially the chocolate and Dr. Pepper.
Exactly.
Yeah. Well, everybody has a weakness, and those are mine. And
Those are mine too, so I
yeah,
understand.
food is my weakness, and I hate to admit that, but that's my biggest issue. And I need to lose some weight, but I listen, I have to get out. I'm gonna be honest with you, my wife's not the best cook in the world. And she admits that, and I love her dearly, but I have to get out and eat. So
This is Debbie. Before we get ready to leave, you can see the slide here with the topic that we've got coming up in July. This has been our first of a series that we are starting, and which will be held on the third Thursday of every month. So in July, we've got Curtis Functional Health coming in. They're going to talk to us about whole body health. So they're going to be covering nutrition, exercise, as well as mental health. And then in August, and I put this up on our chat, we've got a group coming in to talk about 2Ps for older adult transitions, planning and preparation. They're going to talk about options that are out there and things that you should be considering as people are transitioning from maybe one home to a senior living, etc. And then in September, we've got a couple of folks coming to talk to us about, I don't care what age you are, it's right sizing your life and your home and getting rid of those things in your household, especially when you're trying to transition from a larger home to a smaller location. What do we do with those things that are precious to us and our families don't want? So those are some things that are coming up. We hope you join us again next month and the months after. And, hope you've enjoyed this.
Thank you, Debbie.
Thank you, Debbie. And Chief, thank you again. It was really great.
you're very welcome. It was
Thank
my privilege to do it. Thank you.
Thank you, Chief. Thank you, everyone. We hope to see you next month. Have a wonderful, wonderful day.
Take care.